Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Can I use an insect repellent if I'm pregnant? In pregnant or breastfeeding women, the U.S. Centers for Disease Control and Prevention, CDC, states that the following Environmental Protection Agency, EPA-registered insect repellents are proven safe and effective. DEET, N-diethylenetoluamide, picaridin, known as KBR 3023, and acaridin outside the U.S., IR 3535. Paramethanediol, PMD, oil of lemon eucalyptus, OLE. 0.2 undecanone. The U.S. Centers for Disease Control, CDC, strongly recommends the use of insect repellents to prevent transmission of West Nile virus and other mosquito-borne diseases. Most cases of malaria diagnosed in the U.S. originate from other parts of the world. Women who are pregnant should not travel to areas with Zika. If you must travel to one of these areas, or if you live in an area with Zika, talk to your doctor or other healthcare provider and strictly follow steps to prevent mosquito bites and to prevent sexual transmission. CDC has updated news and guidelines for Zika virus and which international travel areas to avoid on their website. What kind of disease is carried by mosquitoes? Mosquito bites can lead to West Nile virus, Zika virus, malaria, dengue fever, chikungunya virus, Japanese encephalitis, yellow fever, rare in the US. Ticks can also transmit disease. The small deer tick can cause Lyme disease. Other tick-borne diseases include Rocky Mountain spotted fever, Powassan virus, ehrlichiosis, African tick bite fever and encephalitis. American trypanosomiasis, or Chagas disease, is caused by a parasite spread by triatomine bugs in parts of Mexico, Central America, and South America, especially rural areas. Do I still need to worry about Zika virus? Most people don't even know they've been infected by a mosquito if they get Zika virus. But if you do get symptoms of Zika, they can include fever, rash, joint pain, conjunctivitis, red eyes. For pregnant women, it's especially important to avoid a bite from the Aedes species of mosquito. Zika virus can also be spread by sexual contact, so condom use is important. Zika virus can be passed from a pregnant woman to her fetus, and infection during pregnancy can cause a serious birth defect of the brain called microcephaly. It's good to know that in 2018 to 2021, the latest data from the CDC states no local transmission of mosquito-borne Zika virus was reported in the continental United States. In 2021, 2 travel-related cases were reported in the U.S. states. In 2020, 32 cases were reported in U.S. territories that were locally acquired. Since 2019, there have been no confirmed Zika virus disease cases reported from U.S. territories. Zika and dengue virus antibodies cross-react, making it difficult to diagnose which virus is the cause of the current illness. The last cases of local Zika transmission by mosquitoes in the continental United States were in Florida and Texas in 2016-17. As always, contact your healthcare provider for answers to questions about the use of any medication in pregnancy or breastfeeding and follow label directions. This is not all the information you need to know about insect repellents for safe and effective use and does not take the place of your doctor's directions. Review their full product information and discuss this and any questions you have with your doctor or other healthcare provider. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.